Hi all ladies and gentlemen, let me introduce myself. My name is Jiu Kelvin. I'm a medical assistant or also called as penolong pegawai perubatan. I'm working at Klinik Kesehatan Bukit Pancor, Spray Selatan Outpatient Department lah. So I also one of the student of OUM Olosta who is taking the Bachelor of Medical and Health Sciences lah. Today, I would like to share with you all about the patient care and management of a patient with schizophrenia. Okay, the learning objective. The learning objective for today's topic I would like to share with you all is after this, I wish or I hope you all will be able to evaluate schizophrenia, run out assessment for the schizophrenia patient, and know how to manage the schizophrenia patient and knows about the intervention about the schizophrenia. Okay, for introduction, I will mainly focus on three main points, which are including what is schizophrenia, subtypes of schizophrenia, and the symptoms of schizophrenia. Okay, first of all, what is schizophrenia? Schizophrenia is a serious mental disorder in which people interpret reality abnormally. So schizophrenia may result in some combination of hallucinations, delusions, and extreme disorder thinking and behavior that impairs daily functioning and can be disabling. So people with schizophrenia require lifelong treatment. So early treatment may help the patient to get the symptoms under control before serious complications develop and may help improve the long-term outlook. Okay, to be more easier for you all to understand, actually schizophrenia is a chronic, severe mental disorder that affects the way a person thinks, acts, expresses emotions, perceives reality, and relates to others. So, though the schizophrenia isn't as common as other major mental illness, it can be the most chronic and disabling. So people with schizophrenia often having problems doing well in society, at work, at school, or even in their own relationships. So they might feel frightened and withdrawn and could appear to have lost touch with reality. This lifelong disease cannot be cured but can be controlled with proper treatment. So contrary to popular belief, schizophrenia is not a split or multiple personality. So schizophrenia involves a psychosis, which is a type of a mental illness in which a person can't tell what is real from what is imagined. At times, people with psychotic disorder lose touch with reality. The world may seem like a jumble of confusing thoughts, images, and sounds. Their behavior may be very strange and even shocking. A sudden change in personality and behavior, which happens when people who have lose touch with reality, is called a psychotic episode. Okay, the severity of schizophrenia. How severe the schizophrenia is varies from person to person. Some people have only one psychotic episode, while others have many episodes during a lifetime, but lead relatively normal life in between. Still others may have more trouble functioning over time, with little improvement between full-blown psychotic episodes. Schizophrenia symptoms seem to be worsened and improve in cycles known as relapses and remission. Okay, next we will be sharing about the subtypes of the schizophrenia. So as we can see in the slides I shared, there are 5 types of schizophrenia, which are paranoid, catatonic, disorganized, residuals, and undifferentiated lah. Okay, as I mentioned before, there are 5 types, 5 subtypes, not 5 types, subtypes of schizophrenia based on the predominant symptoms. That is, a patient is experiencing when evaluated by a mental health professional. So a patient's subtypes can change throughout the course of the illness. These 5 subtypes are not included in the 5th edition of the Diagnosis and Statistically Manual of the Mental Disorder because American Psychiatric Association found that they were not helpful to clinicians because patient symptoms often change from one subtype to another and presented overlapping subtype symptoms, which blur distinction among the 5 subtypes and decrease their validity. Okay, first of all, the paranoid schizophrenia. Paranoid schizophrenia is categorized by unreasonable suspicion and primarily positive symptoms. So the positive in this context means these symptoms are common to this condition and typically respond to medical treatment. So the patient is preoccupied with at least one delusion, usually persecutory in nature, or the patient also is experiencing frequent auditory hallucination. Meanwhile, other symptoms of schizophrenia such as the disorganized speech, flat affect, catatonic, or disorganized behavior are not present with or less prominent than these positive symptoms. Okay, number 2 we have is disorganized schizophrenia. Disorganized schizophrenia is also known as hebephrenic schizophrenia. It is characterized by predominantly disorganized symptoms. All of the following must be present to fit the criteria for these subtypes. First of all is disorganized speech such as word salad, incoherence, perseverance. Number 2 is disorganized behavior such as difficulty starting or finishing a task, difficulty acting appropriately in social situations, and lastly is flat or inappropriate affect such as poor eye contact, lack of facial expression. Number 3 is catatonic schizophrenia. Catatonic schizophrenia is now considered a rare subtype because it's believed to be largely the result of untreated schizophrenia. So it now occurs less frequently among people with schizophrenia as early intervention and treatment has advanced. So it is characterized by a considerable decrease or increase in movement, with at least 2 of the following symptoms present. So a person with catatonic Schizophrenia may be largely immobile, maintain a rigid posture, and resist all attempts to be moved. So on the other hand, there may be excessive, seemingly purposely movement. This can include echolalia, means repeating what other people say, and echoprasia, mimicking the movement of the other people. So there may be peculiarities in voluntary movement, such as bizarre posturing, grimacing, or stereotypic movements such as rocking, hand waving, or nail biting. Okay, number four is undifferentiated schizophrenia. So undifferentiated schizophrenia is a categorization for people who do not fit into the three previous categories. So while such individuals do experience significant delusions, hallucination, disorganized speech or disorganized or catatonic behavior, their symptoms are not predominantly positive, disorganized or movement disorder. So lastly, we have residual schizophrenia. So residual schizophrenia is usually a term used to describe a patient who is not persistently experience prominent delusions, hallucination, disorganized speech or disorganized or catatonic behaviors. However, they are experiencing at least two of those symptoms to a lesser extent. For example, thought distortion or odd beliefs, or they continue to experience the negative symptoms of schizophrenia, such as difficulty paying attention, social withdrawal, apathy, or even a reduction in speech. Okay, these subtypes is distinguished from the residual phase of schizophrenia. So antipsychotic medication effectively treat positive symptoms of schizophrenia, but negative symptoms often remain. Because of this phenomenon, medicated schizophrenia patients who do not report experiencing hallucination or delusion are sometimes considered to be in the residual phase of schizophrenia. So during which time the patient may or may not categorize in these residual subtypes. Okay, next I would like to share with you all is the symptoms of the schizophrenia. Okay, schizophrenia involves a range of problems with thinking, with cognition, behavior, and emotions. Signs and symptoms may vary, but usually involve delusions, hallucination, or disorganized speech, and reflect an impaired ability to function. So as we can see in the slide I share with you all is there are three category of symptoms that are easier for you all to understand. First is the positive psychotic symptoms, positive disorganization symptoms, and the negative symptoms. So first of all, the positive psychotic symptoms. We have hallucination and the delusions. So for the hallucination, hallucination usually involve seeing or hearing things that doesn't exist Yet for the person with schizophrenia, they have the full force and impact of a normal experience. So hallucination can be in any of the senses, but hearing voices is the most common hallucination. Okay, next delusion. So delusions are the false belief that are not based in reality world. For example, when you think that you are being harmed or harassed, certain gestures or comments are directed to you or at you. You have exceptional ability or fame. Another person is in love with you, or a major catastrophe is about to occur or happen lah. So delusions occur in most people with schizophrenia lah. Okay, next we have the positive disorganization symptoms lah. Disorganized thinking or speech lah, or thoughts or language is inferred from disorganized speech. And effective communication is can be impaired lah. An answer to question may be partially or completely unrelated. So rarely speech may include putting together meaningless words that cannot be understood, sometimes known as word salad lah. So extremely disorganized or abnormal motor behavior. This may show in a number of ways, from childlike silliness to unpredictable agitation. So behavior isn't focused on a goal, so it's hard to do tasks. So behavior can include resistance to instructions, inappropriate or bizarre posture, a complete lack of response, or useless and excessive movement lah. Okay, next we have the negative symptoms such as alogia, flat affect, poor attention, evaluation, anhedonia, loss of social interest and attentional deficits lah. Okay, negative symptom actually refers to reduced or lack of ability to function normally. So for example, patient or the person may neglect personal hygiene or appear to lack emotion, doesn't make eye contact, doesn't change facial expression, or speaks in a monotone. In a monotone. Also, the person may lose interest in everyday activities, socially withdraw, or lack the ability to experience pleasure lah. So symptoms can be vary in types and severity over time, with the periods of worsening and remission of symptoms. So some symptoms may always be present lah. So in men, schizophrenia symptoms typically start in the early to mid-20s. So for the woman, symptoms typically begin in the late 20s lah. So it is uncommon for children to be diagnosed with schizophrenia and rare for those older than the 45 years old lah. Okay, demographic data. So in this case study, there was a patient named Mr. C lah. Mr. C is a 35 years old Malay man, engaged and employed lah. He is working under or in his sister's shops lah. So the patient, Mr. C, has stopped working with his sister in 2020 October, when he was COVID-19 positive lah, and get quarantined from at home lah. So the status and condition of Mr. C, actually Mr. C is a stable patient, and at work he's the man could handle simple tasks like cutting papers, printing, and carrying loads in a mini shops lah. Okay, next we have the general health history lah. So Mr. C was first diagnosed with schizophrenia in 2018. due to his abnormal behavior as he was observed climbing roof and breaking the tiles of the house roof, and he behaved aggressively by breaking and throwing the household items and also jumped into a big pool and swam inside the pool lah. So he also removed his shirt at hospital early. He also donate things and money from his sister's shop to random customer and gave money to strangers lah. So Mr. C has no known drug allergies. He is a non-smoker and alcohol-free patient lah. So according to Mr. C's sister, Mr. C has been non-compliant to medication for about 2 months lah. So the reason given was the medication made the patient feel sleepy and could not function well, could not help him to maintain to do the daily activities lah. Okay, next we have the assessment findings lah. So first of all, the physical examination lah. So overall, the generally patient was good, no abnormalities was found lah. So the temperature was 36.4 Celsius, the pulse rate is 109, respiration rate 18, blood pressure 128/88. So the cardiovascular system, the rhythm no murmur, respiratory system, lungs clear, normal breathing. So the abdomen soft, no tender. So no abdominal pain claimed by the patient lah. So the CVS or central nervous system, normal muscle reflexes, no tremors, nerve stimulation, knee jerk and plantar reflex normal. Okay, general appearance and behavior lah. So the general impression is the patient looks nervous lah. So the state of consciousness, patient was conscious, poor physical appearance, poor manner of dressing or cleanliness, abnormal facial expression and posture. Patient was alert and reactive to surrounding, good manner and able to give cooperate lah. So talk, patient speaks Malay and quite talkative. Patient can respond to question. The flight of ideas is present, so negative looseness of clang accession. Sometimes we'll have some talk blocks lah. No mixture language or word salad lah. So for the mood state was instability. Patient was alert and the consistency of mood is suddenly elected, suddenly sad lah. So there are no withdrawal symptoms lah. So next, thought of content or thought content. There are delusion, there are feeling of influence, and there are feeling of passivity lah. So no depersonalization, no hypochondria, and there are hallucination, no preoccupations, no obsession, phobias, and no over-determined ideas lah. Sometimes he has suicidal thoughts, but no repetitive dreams lah. The orientation, the patient know that he's in the hospital and he know what time is it now and he know who was interviewing him lah. Next, memory. So patient was able to recall his past, able to recall where he was caught, able to answer the question. There are no memory disturbance, and patient can remember what we asked him lah. So patient information and vocabulary. Patient is educated lah. So for the attraction, the forward test, the patient can answer clearly lah. So attention and concentration. Patients sometimes will get distracted lah, and the serious 7 test. During the test, patient was cooperative and he has a good judgment but fair insight lah. Okay, for the provisional and differential diagnosis for the schizophrenia, I stated 5 of them. First of all is bipolar 1 disorder with psychotic features. Number 2 is delusional disorders. Number 3 is schizoaffective disorder. Number 4 is certain personality disorders. And number 5 is drug-induced psychosis. Okay, management and patient care. So first of all is the stages of schizophrenia and its features lah. So schizophrenia have a few stages and the management of schizophrenia patient depends on its stage of severity lah. So there are 4 stages of schizophrenia and its feature. Stage 1 is the risk of the premorbid lah. So it may be genetic or based on the environment risk lah. It is asymptomatic. So when the patient step into stage 2, it's a prodrome lah. So it will cause cognitive and social deficits, and patient might need to seeking for help lah. So when patients step into stage 3 of schizophrenia, where the acute psychosis episode might be occur lah. So their feature is the schizophrenia might be relapsed and remitting, and there would be suicidal risk lah. So lastly, the stage 4 is the chronic psychosis, or we call the residual phase lah. So it might be caused by the medical complication and disability lah. Okay, for Mr. C, Mr. C symptom develops in 2015 but was first brought to medication attention on 2018 at Hospital Bukit Medajam lah. So at the time he started on that risperidone and maintained well in full remission lah. So he became unwell starting September 2020 and was admitted at Jalan Perak lah, psychiatric clinic Jalan Perak for the first time and was treated for schizophrenia lah. So he was in that risperidone 1 mg BD upon discharge and continued for a while. So in October 2020 he was readmitted for the second time and stayed in the ward for at least 1 month and discharged with IM Modicate 25 mg monthly due until 23rd of November 2020. So tap olanzapine and 30 mg on night, tap epilene 600 mg BD, and also tap lithium 300 mg BD were also prescribed for Mr. C lah. The treatment for the schizophrenia normally the patient will be prescribed with antipsychotic medication lah, such as risperidone, quetiapine, olanzapine, and Latuda lah. So the ECT, electroconvulsive therapy, might be also an option for bipolar treatment lah. If the patient don't get better or get well with the medication, or the patient cannot take antidepressant for health reasons such as pregnancy or are at high risk of suicide. So in addition, cognitive psychotherapeutic or psychotherapy may also be useful for some patients, okay, such as cognitive behavior therapy. Okay, lastly, conclusion. So in conclusion, schizophrenia is a complex disabling psychiatric disorder which will impair cognitive, perceptual, emotional, and behavior functioning that needs intensive treatment at the early sign of the psychotic episode. So I hope all the healthcare providers, which includes specialists, doctors, MAs, nurses, or even PPK, uh, must consider about the potential outcomes for non-adherence and treatment-related adverse effects when developing a comprehensive treatment plan for the schizophrenia patients. So I also wish that next I also wish that the future research about schizophrenia will address gaps in treatment and potentially create a cure for schizophrenia patients. And lastly, I hope that everybody will be more understanding and have more knowledge about schizophrenia. The consequences of schizophrenia and its clinical range must be understood urgently in order to manage this potential illness. So we must not only consider the medical aspect of the schizophrenia, but also the psychosocial aspect of the life of those who are suffer from it. Okay, that's all for me. Thank you so much. Thank you. See you all again. Bye.